Cases of COVID are continuing to rise, and although rates aren't doubling every week anymore, a 40% increase on large numbers of cases, so 1,300 cases a week, is quite significant. In some areas of the county, numbers have risen at an even more alarming rate over the last week, and we've had over 2,000 new cases reported in the last 7 days. But we know that actually they're only a proportion of the number of people with infection in the community. Now, more than a third of those tested reported that they'd had no symptoms. And despite the fact that we're a county with lots of fresh air and space, we still have the 14th highest rates in England. The pandemic is very much still with us, and it's absolutely vital that we all continue to be cautious. The Delta variant is more transmissible and it continues to spread in our communities, largely amongst those who remain unvaccinated. From the 19th of July, England will have moved to step 4 of the roadmap. So what that means is that legal restrictions and social distancing will be lifted. The continued use of face coverings will still be advised in crowded and enclosed spaces, including public transport. For England, there'll be a gradual return to work. There's new guidance for the clinically extremely vulnerable on how to keep themselves safe. The existing border policy will continue to apply after the 19th of July, including quarantine for those coming back from red-listed countries. Test, trace and isolate will also continue, so there will still be a legal requirement to self-isolate if you're contacted by NHS Test and Trace. And nightclubs and other venues will open, but they're encouraged to make use of COVID passports as a means of entry. Well, this change comes at a time when cases are rapidly increasing, and we do need to learn to live with the virus, but the lifting of restrictions is not without risk. Those risks revolve around increased hospital admissions and deaths, an increase in cases of long COVID, workforce absences, and the emergence of new variants, which might be worse than the one that's circulating at the moment. Now, we can expect to see cases increase for some time, and there's lots of uncertainty about how big this wave will be and the impact it will have. But what we do know is that the more cautious we are and the slower we return to pre-COVID behaviours, the more likely we are to minimise the peak. So we all have a part to play in making this work and in keeping our communities safe. It is absolutely critical that we remain cautious, and by being vigilant and keeping up with those simple steps we've been really good at doing over the last year, we can all stay safe. So let's keep washing our hands regularly. Let's meet up with friends and family we don't routinely mix with outside. Let's get ourselves tested and self-isolate if we have any symptoms that we think might be coronavirus. Continue to use face coverings in crowded indoor places and on public transport, and let's keep taking up the offer of both doses of the vaccine. Well, people who haven't been vaccinated are at much greater risk of becoming unwell and also of transmitting infection. And just because you're young doesn't mean that COVID-19 is risk-free. Some younger people will end up in hospital and more will go on to develop long COVID, which for some people has meant they've been unable to work for months or to go out and enjoy the freedoms which we've gained over the last few months. So having the vaccine is one of the best things that you can do to protect yourself and others. So it remains really important that everybody comes forward for both doses. We know that vaccines protect most of us from serious illness, they help to reduce infections, and their effectiveness increases as more people are fully vaccinated. So getting both doses of vaccine is really our best hope of reducing the serious health harms caused by COVID. It's effective against all the current variants that are circulating, particularly if you've received both doses. And the more of us who have it, the more we'll lower the rates of COVID infection in our communities and reduce the risk of more serious variants emerging. We've got loads of appointments available through www.nhs.uk or at walk-in vaccination centres throughout the region. So if you haven't already, please make sure that you take up this offer and get both doses. The vast majority of people aged 18 or over can have the vaccine. You can book appointments at a larger vaccination centre or pharmacy now via the online booking system, or you can wait to be invited by your GP. If you were called some time ago but weren't quite sure whether to go ahead at that point, you can still book an appointment now through your GP or using the online booking system. It is never too late to take up that offer. You'll need to book a second dose for about 8 weeks after your first dose, but if you go through your GP, they'll probably call you forward at around the time the 8 weeks is up. If you booked at a time when the second dose was 12 weeks after the first, you can go online and cancel that second dose and bring forward your appointment, but just be aware that you may end up travelling further away because you'll only be offered appointments at centres which are offering the same vaccine you had for your first dose. I'd really strongly encourage people to continue to use face coverings, particularly in crowded indoor places. Wearing them in busy indoor areas and on public transport will still help to protect those around you, even though they're no longer legally required. And we also need to consider the feelings of some of the most vulnerable people in our communities, because they're telling us that actually they're really concerned about using public transport if face coverings aren't worn. And although restrictions are about to be lifted, we're not really heading back to life as we know it. So we must continue to work together to protect ourselves, our families, and our communities. In order to keep our staff and visitors safe, we will be maintaining the majority of our COVID safe measures in all council venues. We'll be expecting all staff to continue to wear face coverings as they are now, and we'll expect members of the public to wear them when they use our buildings, although that's no longer legally enforceable. There's a lot of uncertainty about what will happen over the next few weeks, and that's because it's entirely in our hands and the extent to which we maintain those behaviours that prevent transmission while we continue with the vaccination programme. So please keep doing what you've been doing for a little longer and enjoy the lifting of restrictions in a safe way.